Well, hope your summer's going good. Ours is winding down. It's almost the end of August. The kids are coming back, and very interesting. I'm seeing a real big increase in number of headaches, especially in children. Um, Headaches, first of all, are very misunderstood. Our tendency is to medicate, which I get. Your head hurts, you take this, stops hurting. Voila, your headaches are cured. But as a chiropractor, I want to share something with you. The medical profession really doesn't know what causes headaches. There's speculation about different reasons. If you watch any drug commercial on TV, one of the Kardashians is promoting a migraine medication. Great. But here's the thing is, people use Botox, heavy duty medications, and the headache still exists. So it's not really fixing a headache. And let's be really honest, not every chiropractor fixes headaches either. I happen to enjoy treating headaches, one, because I think I have a better understanding. And so what we're going to do today is it's probably going to be a couple different talks on it because it's just such a wide opening topic. But let's start with an education about headaches. I'm going to start on a different topic. Meningitis. What is meningitis? Well, here's some of the things. There's a lot of similarities in the symptoms between it. Okay, now listen. Meningitis itself is an infection. It's inflammation of the covering, the protective membrane that surrounds the brain and the spinal cord. Okay, so if you get a virus in there, a bacterial infection, you do not go to a chiropractor. As a matter of fact, they just bring your chin to your chest or try to bring you lay on your back and try to bring your knees up to 90 degrees. From you start at 45 and go to a 90. And if you feel tension, go right to the hospital. You need to get that worked on. But what I want to do is I want to draw similarities here because I think tension on the covering, okay, the covering around the spinal cord and the spine itself and the brain is this, the meningeal covers three of them. There's the dura mater and the pia mater. And when you have tension on those areas, you can have serious headaches. Okay, let's go over the symptoms with similar symptoms of meningitis and just say migraines, for example. Both cause severe headaches. Migraines are typically characterized by throbbing or pulsating pain. Pain is pain. A migraine typically one side of the head. Meningitis headaches can be more intense and could be accompanied by neck stiffness. Let me tell you something. Neck stiffness is a pretty common thing with migraines. Very common. Okay? And what happens is this protective covering has a lot of nerves, awful lot of nerves. And when they get clamped on, it's tension. And let's say this is just tension on top of it, you're going to have headaches. So let's just go in. Okay, here's a similar. So headaches, you can have both. Okay, bad headache's a bad headache. Now, if it has the neck stiffness again, I think you should go right to the emergency room. But if you have chronic headaches accompanied by neck stiffness, it's probably not a bad idea to go to a chiropractor. Well, you know what? Let me take that back. Go get a massage, see if that releases the headaches. Because if massage is going to release the headaches or tame the headache, um, then have at it. I mean, get what you need, which is a pain-free life. Both have can have potential nausea and vomiting, but I think I would have to say with meningitis, you're going to have a much deeper level of nausea and vomiting. I mean, people get headaches regularly where they experience nausea and vomiting. They're kind of used to it, you know, and it's but the cause is okay. What I'm suggesting here is irritation in the meninges and the dura can cause headaches. Okay, and another one of the similar symptoms: sensitivity to light and sound. People get a bad headache, go in a dark room, cut out all noise, put earplugs in, put your pillow over your head, enough so you can breathe, though. Okay, so they have the similarities there. So what I'm trying to get at here is tension on the meninges and the dura, which are connected. One's an inner layer, one's more outer layer. I won't go into the pia model later today. It doesn't make a difference, I don't think. But I think these two layers are nerve dense and can cause a lot of headache pain. So how do you address? Also, I'm sorry, I'm getting away again. Fatigue is also, when you're going through a trauma, when your brain has got tension on it, it's going to use up. It's going to make you tired and fatigue. So, and also general malaise, which is typical. You just get over a headache. You don't feel like going out to a basketball game. You don't look to go for a run. So, so what happens is, probably the difference between meningitis and migraines would be the fever and body aches, and that's kind of the probably the biggest one to look out for. Because when you're getting fever again, it's kind of more an infection, and that's kind of you got to go to the emergency room. Don't wait around because meningitis is very inflammation and pain that caused by infections or virus need to be addressed medically, not chiropractically. But that is, the protective covering is very, very dense. Like I said earlier, dense and nerve rich, and you got to kind of protect it. But what happens that I've found is the occipital bones. If you just took your hand, let's say if you're right-handed, take your right hand, slide it to the back of your neck, and where you feel the soft tissue come into play, that's the cervical number one we call atlas, and cervical number two right below that, the brainstem still comes down to that area. So just kind of want you to think about if you had a balloon that was blown up, where you tie the balloon off, where you would blow the balloon up as being the brainstem. So you got this little piece of brainstem, and if a bone is leaning into it, as the occipital bone can, and does cause this type of a tension on the meningeal system and the dura as well. And there is a good solid causation in my mind for a headache. And a headache, okay, all bad headaches are pretty much migraines. Okay, you have sinus headaches, you have the cluster headaches. You got a lot of different names, but it's still a headache. All right. So what a chiropractor would do is take tension out of those areas. But let's explain why you would have tension in those areas. People are on devices, phones all day long. You crane your neck forward. We call that condition text neck. People just go forward, and what it does, it creates tension in the shoulders, upper back, because those muscles are bigger than they are in the neck. You have a lot of muscles in the neck, and those attach to the back of your skull and kind of tether it down. And so what happens if those muscles are extra tight because of certain tension, and how do you get tension like that? Like a text neck. Kids today, let's go to teenagers. Teenagers today very rarely sit at a desk and work on a PC. They're going to be laying in their bed with the laptop open doing their work when they do their work. I'm assuming that most kids do their homework. I know I was an angel, not really, but anyhow. So this is a good reason. Now another thing too is you're gonna have tension where you're not going to get the right amount of sleep. When you have neck stiffness, do you sleep as well? Hell no, you do not. It's not that easy. It's quite difficult to really sleep well when you have neck stiffness. All right, so that's one issue. But when you have lack of sleep, what happens is you're fatiguing, and then the fatiguing is both meningitis and headaches. And I know I'm going all over the place, but try to stick with me so you can understand. Irritation of the meninges and the dura mater can be the cause of headaches. If you relieve tension at the occipital level, occipital bone is that bone before you put your hand on the back of your head and slide down, right before it goes into soft tissue, we can feel the muscles on the side. That's the occipital bone. So when there's a disrelationship there, there's pressure. You're tightening up the covering on your brain and the spinal cord, so it can have all kinds of neurological symptoms. And typically, bad headaches, be it migraine, cluster, sinus, etc., have tension on that system. And this is where I feel chiropractic care could be one. It's a lot safer than taking medications. All right, they put kids on all kinds of medications, and you know what? That's how you solve the problem. If you went to medical school, God forbid, a medical doctor says you've got headaches, go see a chiropractor. Listen, I get enough headache cases coming in here that there has to be a reason why they're getting better, and chances are it's because of the chiropractic adjustment. Now, people are concerned: is the headache is it safe? Listen, you got to take X-rays, you got to do your exam. That's up to the individual chiropractor. Not that I'm a real doctor. I don't want to say that, but that's what you do. You have to examine the case. You look into someone's eyes, you shine the light, and you see if there's anything that would tip you off that it's not a case of, one of the big ones they call nuchal rigidity, which is a nuchal line. There's real tension there, and that's there's a couple different orthopedic tests, Brzezinski's and Koenig's, that will indicate more so if you have a meningitis, because you'll have tension throughout the inflammation and the infection will be out throughout the whole spine. But knowing this, why would you subject your children to medication which have side effects? Okay, chiropractic care really doesn't have side effects. Kids respond swimmingly to chiropractic care, conservative chiropractic care. And there's many different ways. There's a technique we use a tool called an activator to tap the bones back into place. Good chiropractic care doesn't have to be painful. It doesn't have to be painful. My goal typically is I operate on three concerns: safe, comfortable, and effective. And when a patient presents, I'm going to be safe, I'm going to be as comfortable as I can, and I'm going to be as effective as I can. And sometimes you have to mitigate between the three in order to accomplish that goal. And it's not a one-time thing. Typically, you're going to have to see a chiropractor up to 6, maybe 8 weeks, 10 weeks. Depends on how long you've had the headaches. It depends what we see on X-ray. Now, if you have a loss of curvature on an X-ray, that is indicative because of extra tension on the shoulder muscles because they're picking up the slack. The weight of your head is supposed to be supported properly. When you have a text neck, you have a flattening of the cervical curve. Okay, we call it a lordosis. Cervical lordosis is very important because when you have a good lordosis in the cervical curve, the weight of the head is supported by what we call facet joints. And the facet joint is where the weight's born. Now, when you lose that, you could be digging into the spinal cord, but you also have the muscles. So the muscles tighten up, and that's why it's going to present. And hey, you take a muscle relaxer and the headache goes away, you have a cure. Listen, if it solves your headaches and you're happy, then I'm not going to be seeing you. But if they keep coming back, what are you really doing? You're quieting the nerves a little bit with medication instead of trying to address that tension on the base of your skull, the brainstem. Okay, at the base of your skull, you have the brainstem. It goes down about 2 levels, the cervical 1 and cervical 2. If we take pressure off of that, there's a lot of reasons. And I also follow up with physical therapy. I do physical therapy in my office all the time. It makes the process go a lot quicker. So listen, everybody wants to get better faster. It's also less expensive. And in the insurance climate today, that's very important. So you got a kid who's got reoccurring headaches. See how they're sleeping. They're always tired. Are they always on their phone, holding that phone, craning their neck, which can induce text neck. And then all of a sudden you start to lose the curve at an early age. You have tension on the spinal cord itself, which is going to make, if you have tension on your spinal cord, there's the covering, okay? The dura mater, pia mater, and the meninges, that covering is you're tensing it up in the brain as well. It's not just the spine, with what we call it the bone out of place, putting pressure on a nerve. You're tensing the whole area. You relieve the tension, and you can and will see a marked difference in headache presentation. Headaches is like one of the things, I kind of think they're one of the easiest things to fix. Someone with a bad back, you got to do a lot more exercise. Cervical traction is wonderful to help restore the curvature in the neck. Very, very important. So there's a lot of different things that people aren't aware of because one, if you go to your medical doctor, he's not going to tell you to go see a chiropractor. Unfortunately, maybe some do, but for the most part, since a headache is a neurological condition, reoccurring migraines are going to be sent to a neurologist. And listen, neurologists do a great job, but they're not solving headaches. There's not a medication out there you could take and say, hey, my headaches are cured. No, you have to keep taking it. And actually, they're quite expensive, but insurance companies are more apt to pay for $4,000 or $5,000 a month in treatment, but not a solution. You don't have to spend $4,000 or $5,000 with chiropractic to find out if you're going to get relief for your headaches. So it's not a bad idea to do both if you really want to stay out of pain and fix the source. But it's a different approach. It's a natural approach. There should be virtually no side effects to the chiropractic adjustment, and it can be done safe, it can be done comfortable, and it can be effective. So irritation of the covering of the spine. Again, the dura mater and the meninges. The pia will leave it alone. They're densely populated with nerve endings known as nociceptors, and these nerve endings. A nociceptor is kind of a sensitive to mechanical stimuli such as pressure. Okay, you have pressure and tension. Guess what? You got text neck. You're gonna have tension and pressure on the baseus spine, your brainstem, and you're also going to be subject to headaches. So if you take that tension out, you got a good chance of ending your headaches. So when the nociceptors, these specialized nerve endings are sensitive to mechanical stimuli, such as again stretching, pressure, tension, they send pain signals to the brain. So if you take out the pressure and the tension, doesn't it make sense that potentially your headaches are going to respond as well? And the other thing too is when you have tension on the dura, it can trigger an inflammatory response to surrounding tissue. So now you have inflammation that can lead to different pain presentations that could be confused between a sinus headache, migraine. The other thing too I want to point out is rebound headaches. Sometimes people on too many medications, and that causes a problem as well. So here you go, is you have these special nerve endings, and when the nociceptors, again, those are the ones that's mechanical. The nerves are sensitive to mechanical stimuli like pressure and tension. Okay, tension headaches. They can contribute to even a greater perception of pain when this it amplifies it basically. So when you have these nociceptors, and have these nerve fibers that are aggravated, you're gonna have a headache. Stop that, and guess what? Then go away. So there's different pathways that these nociceptors, go to, but different sections of the brain, and so it's perceived differently. So I have pain in an eye, I have pain in the back of my neck, I always have my neck is stiff, or I feel tightness in my neck. I'm about to get a headache. So there's different ways to take this tension out. Chiropractic care with sound physical therapy is really important. Now, physical therapy alone, if it doesn't move the bone off of the brainstem, you can get relief. But it's probably a good indicator. Like say if you go for massage and your headaches go away for the short term, that's a good indicator that you would be a good candidate for for chiropractic care. And you really probably should get an X-ray. I think they're really important to see. I mean, recently I had I was gonna say I had the good fortune of X-raying a young man who came into me who had neck pain and it started going down his arms. His mom took him to the emergency room. It happened to be a trampoline incident. So once I took the X-ray, lo and behold, the hospital didn't take the X-ray, and this kid had a broken neck. And so I had well, obviously, it was probably the best day of my life because I sent this kid out immediately to the emergency room for a CAT scan. CAT scan was done. He was rushed to Yale, New Haven. I'm in Connecticut. He was rushed to Yale, New Haven for emergency surgery. Guess what? The kid just started school. This has only happened about 3 or 4 weeks ago. He's starting school, college right now. So what happens here is an X-ray is a good idea, and if anything, you could probably get by with just a cervical lateral X-ray because then you can get enough information to see do you have a loss of curvature or, in my case, an actual neck fracture. I can't believe that somebody goes to the hospital with a trauma and they don't take an X-ray. They send the kid home with muscle relaxers. This kid, of course, because I spoke to the neurosurgeon afterwards, this kid could have sneezed and been paralyzed for life. It's horrific just to think, but in this case, we had an incredibly happy ending. You'd be surprised at how many people were looking at my profile, checking out the reviews. Because this mom wrote a really glowing review for me, which is always nice. I always take that. But so these different headaches might be able to be helped with chiropractic. Just might. Now, typically, though, here's the thing: is, as with anything, you don't see a significant improvement in 4 to 6 weeks, then it's not the right treatment for you. But how do you know if you don't do it? Do you keep taking that medication? The doctor says, hey, just take this medication the rest of your life. Eventually you grow out of the headache. I mean, we do see headaches start to drop off postmenopausal in women. It's kind of been it's an interesting aside for me because we see so many headache cases here. Let's go over different types of headaches. The primary headaches are headaches not caused by underlying medical condition. Now, since I'm not a medical doctor, chiropractic situation is not considered a medical condition. But the base of your brain is being, the brainstem is being impinged by the occipital bone and tightness on the muscles in the area. You can get tension headaches, you can get migraine headaches, cluster headaches, some secondary headaches. Could be from medication overuse, sinuses. Sinuses can cause headaches. Now, here's another thing too, is I want to point out. A secondary headache is considered as like a tumor. They're rare, but if you're not getting better after 4 to 6 weeks of conservative chiropractic care, I think it's a real good idea that you get an MRI of the brain. Really, someone, especially if they're worsening. A lot of them, some dental problems will cause headaches when you have bruxism, when it's the grinding of your teeth, or TMJ issues can lead to headaches because that's all affecting that suboccipital atlas one cervical number two area. Cervicogenic headaches. Those that would be like the easiest one you could connect the dots and say why a chiropractor would be successful in treating headaches. Hormonal changes can increase tension on the dura mater and on the meninges. Ergo, headaches. Sinus issues. Sometimes sinus issues are not in the realm of chiropractic care, and but again, a headache's a headache. One's often overlooked is sometimes vascular issues. I mean, it's trauma. Trauma, you can have, you have a concussion, you can have a headache. That can easily lead to headaches. Infections also. Again, infections are not a chiropractic reason to. You don't treat it. Don't go. You have an infection. Don't go to a chiropractor ever, please. Well, for the headache due to an infection, I should say. That would be a little self abating, if I may. Medication overuse can cause secondary or rebound headaches, and that's pretty. If you're taking a pill to solve one problem, but it creates another, you just got to live with the side effects. Again, probably more of a good reason to go see a chiropractor. So, the thing I'm trying to get at here is a common sense approach to headaches is not just taking a pill. You got to take a pill for the rest of your life. The insurance company's paying 3-4 thousand. Some of these things are $3-4 thousand a month. Botox is about $5,000 a month. You can imagine how happy the pharmaceutical industry is when you start taking Botox. Botulinum. People use it to take the lines out of their face. Well, it takes tension out of the head. It does. It relaxes the muscle. It quiets those nociceptors, which are reacting to mechanical stimuli. I think we beat this up pretty good for today. But here's the thing. Here's the takeaway. Your kid's got headaches. What are you going to do about it? Okay, you go to your medical doctor. Go see a neurologist. The neurologist says, "Oh, you take this pill. This pill doesn't take effect. We'll change it out again." Relaxation techniques, all good, but it's kind of you're prolonging the person's agony. Go see a chiropractor, but meet with the chiropractor first. I mean, there's no reason. You have a concern, get in there and say, "Hey, listen, why do I have, you know, beat the guy up a little bit, and get good answers. And if you don't like the answers, don't go to the chiropractor. I mean, you get bad answers from any doctor, don't go back. I think, again, a common sense approach. If your kid's got headaches, it would be in the best interest to get at least a look with a chiropractor and see what they have to say. Now, if you don't like what they have to say, well, then don't go to them, go to another one. Or, go back to your medical doctor. But if the headaches last for a long time, chronic headaches, okay? Chronic could be anything, past 3 or 4 months on a regular basis. Well, in that case, it would probably do you right to go get an MRI. You'd rather be safe than sorry with headaches. And it's very rare that tumors are going to occur that cause headaches, but they do, and it happens. So be safe. Get an MRI if it doesn't work, if you don't see results. Listen, I'm Dr. Brian McKay, and I do enjoy treating headaches. And I have no problem speaking to you wherever you are, wherever you listen to my podcast. But reach out. I'm more than happy to talk to you because, one less headache is a darn good thing out there. And many, many people with less headaches is even better. My phone number, 203-656-3636. 203 656-3636. Shoot me a call. I mean, I can't talk to you when I'm seeing patients, but I'm more than happy to give you a call back and offer any advice, you know, that I can do. And if you're worried about, you know, comfort level, the chiropractic treatment should be comfortable. It should be safe and, more importantly, effective. I'm Dr. Brian McKay for Not Just a Chiropractor podcast. I hope you learned something. And if your kids got headaches, my recommendation, go see a chiropractor. Take care, have a great day, and enjoy the rest of your summer.